Ladies and gentlemen, please welcome Colleen Brunetti, PHA Board of Trustees member and PHA Development Committee co-chair.
Good afternoon, everyone. So, is everyone enjoying conference so far? Wonderful. So before we begin our luncheon, I want to highlight some of the great opportunities available to you at conference this year. First, have you had a chance to stop by the exhibit hall? Be sure to check it out this afternoon from 1:30 to 5:45. While you're there, remember to stop by the PHA Resource Center, talk to our volunteers, and pick up some great resources. Also, while you're at the PHA Resource Center, please sign the advocacy petition. You have an opportunity to let Congress know that we need a PH program at the Centers for Disease Control and Prevention to promote early, accurate diagnosis and quality PH care. Let's get 500 signatures on that petition. Currently, we have 203, so please add your name. You can also sign up to be a member of PHA's Grassroots Advocacy Network at the Resource Center. This means calling or emailing your members of Congress a few times a year about issues that matter to us all. I'm a member, and I can tell you that PHA makes being involved easy. By consistently reaching out to my representatives, they've gotten to know me and my PH story, and some have become very receptive to requests for legislative support for causes near and dear to patients like us. You can have a voice in the national conversation on healthcare. And in my opinion, never has that been more important than right now. Next, if you haven't done so already, you have time this afternoon to stop by the research room. It will be open until 6 p.m. tonight. Everyone, not just patients, can participate. I'm always amazed to think that the first PH gene discovered was because of a research room just like this one at the very first PHA conference. Dr. Elliott, the doctor responsible for the discovery of that gene, says the DNA that he collected at that conference would have otherwise taken him 8 years to gather. So go check it out and be a part of history. And for something new this year, how many of you have been to the art gallery? Went up this morning. Okay, I was just there this morning, and there are some really incredible pieces created by talented individuals in the community. You can purchase raffle tickets to bid on the pieces of art. Tickets are only $5 each, and they are only on sale today until 6 p.m. Well, this is my 5th conference, and I am so thrilled to be with you today. I was diagnosed with PH in 2008, and one of the reasons I love this session so much is that each of us has our own unique journey to diagnosis and treatment, yet we're all on this journey together, with our healthcare providers and with each other. I know I'm so grateful that my healthcare team has been there every step of the way. The Journeys Lunch has been a part of PHA's conference since the beginning in 1994. Today, we have invited 3 individuals living with PH and a member of each of their healthcare teams to tell us more about their shared journey with PH, from diagnosis to challenges in treatment to finding their hope for the future. As you'll see, each of these relationships is unique, but together they reflect how much PH is truly a shared journey that includes patients, caregivers, and medical professionals. We highlight just 3 stories, but we know there are so many journey stories in the audience, and each one of those is also unique. Before the panelists begin, please join me in thanking Bayer for sponsoring this session. I'd like to invite Melissa Penn, Deputy Director of Advocacy and Cardiopulmonary at Bayer Healthcare, to the stage for a few words.
Thanks, Colleen. Hi, I'm Melissa, and as Colleen mentioned, I work for Bayer in advocacy, and I started 1 week ago. So, thank you. I come from the nonprofit world in the rare disease space, and what attracted me to this position was not just that it's in patient advocacy, but it was Bayer's commitment to making lives better for patients in this community, and really it's this community, because every single person I interviewed with at Bayer told me what a great community it is. So I scrambled to get all my paperwork together so that I could start before this meeting, because I know that there is no better way to listen and learn than to see and hear and feel the community. The theme, Finding Your Hope, really resonates. It's such a beautiful phrase, and the hope that I have felt the past couple of days is so palpable. And you know, from the 75 volunteers and the PHA staff and the physicians and nurses and the community that come together, it's great. So I had to say, and some of the newcomers, I know there's so many first-timers, like coming in as a first-timer, it's a little overwhelming. But the love and support and strength from each person and towards each other, it's been overwhelmingly beautiful. So thank you for welcoming me. I hope to meet as many of you as possible, so I'm sitting over there in that table with some of the Bayer folks in the blue shirts. So hopefully you come and introduce yourself. And on behalf of Bayer, thank you for allowing us on this journey of hope with you.
Thank you again to Bayer and to Melissa. Now, please join me in welcoming Nicole Creech to moderate our panel today. Nicole has been living with PH for 10 years. She's a PHA support group leader in Lexington, Kentucky, and a member of the PHA Support Group Leader Advisory Board.
Good afternoon, everyone. It is my honor to facilitate this afternoon's Journey panel. I want to give the panelists as much time as possible to share their stories, so we'll jump right in, okay? First, our first panelist pair is Evette Britton and Dr. Ivan Robbins. Yvette has been living with scleroderma for 21 years and PH for 13. She is the leader of the Nashville PH Support Group and a member of PHA Support Group Leader Advisory Board. Yvette loves spending time with her grandkids and seeing the world, even when her travels make her doctor nervous. Dr. Robbins is a professor of medicine, the director of Pulmonary Vascular Center, and the director of the Lung Transplant Program at Vanderbilt University, a PHA-accredited PH Center of Comprehensive Care, or PHCC. Dr. Robbins has been treating PH for more than 20 years and served on PHA Scientific Leadership Council, the SLC, from 1999 to 2010. Dr. Robbins has a son in high school and a daughter in college and enjoys reading and traveling. Our second panelist pair is Riley Wigley and Dr. Russell Hirsch. Age. Riley is 7 years old and was diagnosed with PH when she was 4. She's actually the youngest member of the support group in Lexington, Kentucky, which I lead. Kentucky in the house, yay. Riley will be entering the 2nd grade this fall and loves art, animals, and helping people. Dr. Hirsch is the director of the Pulmonary Hypertension Service in the Cardiac Catheterization Laboratory at Cincinnati's Children's Hospital Medical Center, one of the 8 PHA-accredited pediatric centers of comprehensive care. Our third panelist pair is Carol Bowling and Dr. Dana McGlothlin. Carol Bowling is a co-leader of the Sacramento PH Support Group and the coordinator of PHA's monthly patient-to-patient support calls. She has been living with PH for 9 years and takes every opportunity to help smooth the road for newly diagnosed patients. Her motto is, "It's a great day to be alive." Carol enjoys spending time with her family and is a Disney enthusiast. Dr. McGlothlin is the director of the PH program at Kaiser, Northern California. She has been treating PH and volunteering with PHA since 2004. Dr. McGlothlin is a speaker in PHA's medical education on-demand program, as well as at other PHA events, and has participated in several PHA fundraising walks. Speaking of walks, she also enjoys walking and playing with her dog. Now let's get started with our first panel.
Thank you, Nicole. Before I was diagnosed, I'd made numerous trips to my local ER because I couldn't breathe and I had zero energy. They didn't have a clue as to what was wrong with me. They'd keep me a few hours, and then they'd release me, even though I could barely walk out of there. It never occurred to me that I had pulmonary arterial hypertension. I have scleroderma, so I was getting my yearly echoes, and I was having my pulmonary function test twice a year. In fact, I just had my PFTs the month before I was diagnosed. I was told that I had a bit of asthma. My PAH was detected when my primary care doctor ordered my echo a few months before I was due to have one. The night after my echo, I ended up right back in the ER because I was struggling to breathe. They did a chest x-ray and compared it to the one I had done on a previous visit. When they realized that my heart was larger, they admitted me for congestive heart failure. The next morning, the day I'll never forget, Tuesday, March 29, 2005, a cardiologist walked into my hospital room. He said, "I have the results of your echo. You have pulmonary hypertension, and there's nothing I can do for you." He then walked out. I was in the hospital for 3 more days, and he never came back in. Luckily for me, my primary care doctor's partner and my rheumatologist knew that there was a doctor that could help me. The following Tuesday, I went to Vanderbilt for my first visit with Dr. Robbins. I was in such bad shape, I needed oxygen to do the 6-minute walk, and even then, I couldn't complete it. During the visit, we discussed pulmonary hypertension, and I told him that I didn't want to be on Flolan. I'd had a friend that had scleroderma and PH, and it didn't go well for her. And I was terrified that it wouldn't go well for me either. I spent a week in Vanderbilt. I had my first right heart catheterization. A few days into my stay, Dr. Robbins came into my room and informed me that I needed to be on Flolan. I cried and cried. It didn't matter that I didn't want to be on Flolan. What mattered was that I needed to be on Flolan. To this day, I'm very grateful that Dr. Robbins didn't listen to me because Flolan saved my life. I was on it for about 5.5 years. For the next 11 months, I was on the combination therapy of Tyvaso and 1 5-milligram Letairis. Since August 2011, all I take is 1 10-milligram Letairis. No one is more surprised by this than me because I used to tell my husband to bury me with my pump. When my PH journey began, our first grandchild was due. I was afraid that I wouldn't live to see him be born, or that I wouldn't live long enough for him to remember me. Last week, Michael turned 13. Our granddaughters are 11 and 9. In closing, I'd like to offer advice for people that are at the beginning of their journey. Find a doctor that specializes in pulmonary hypertension, not just a pulmonologist. and learn all you can about your illness from reputable sources such as PHA. And lastly, and this is the most important one, live your life. When I attended my first conference 12 years ago, a lady in one of the sessions stood up and said, "I ain't dying till I'm dead." I took that to heart, and I hope you will too. Thank you.
All right. Well, so you've heard a lot of Yvette's story. Our journey has been going on for 13 years, which I guess means I'm 13 years older. So that's the bad part of it. But the good part is that she has done amazingly well. And I think probably you've sampled pretty much every kind of medicine we have, would you say?
Yes, I agree with that.
Yeah. And she wasn't very pleased when I told her that I thought we needed to use IV medication to start with. I don't think there's really anyone out there who's too pleased about that. But her pulmonary hypertension was really severe at that time. And so she finally agreed. And I will say that her strong spirit is one of the reasons why she's here. And we have many little discussions. We like to say we're each other's new best friend all the time. So I think that's certainly part of why she's done well. And anyway, so she was on that for a while, and but has now, gone to monotherapy, one oral therapy, and her pressures are nearly half of what they were. So you've done a great job, and really, in addition to that, I would like to point out some other things that makes Evette very special. One is her caring for other patients. She's very active in our support group, both for pulmonary hypertension and for scleroderma, and has spent countless hours helping and talking with other patients, which I think makes this one of the very special associations and diseases that I know of. She doesn't always listen to what I have to say. As she alluded to, she's gone on some cruises, which I wasn't too excited about, but as she said, you have to live your life, and she's done well with that. So I guess I'm just going to have to listen to you a little more.
Yes, you should.
It's taken, I'd say, about 10 out of the 13 years to finally make it so that you understand that every time you feel a little short of breath, your disease isn't getting worse. So she's finally calmed down after about that time. But I guess for me, the best part of this journey is that I've been able to help someone, and to see you sitting here is really the best present and reward that I can get for doing what I do. And, we're just all very impressed by everything you've done, and really just hope it'll continue for as long as I'm working, at least, and maybe even longer.
You've got to tell them that you love me and I'm your favorite patient.
Sorry, I forgot that. I do love her, and she is my favorite patient and my new best friend.
Thank you, Evette and Dr. Robbins, for sharing your unique journey. I love how much you all love each other. It is a pleasure to see patients who get along so well with their doctor.
Well, I think, I'm off. I'm cut off. All right. Anyway. All right.
So let's move on over to our second panel, Riley Wigley and Dr. Russell Hirsch.
My name is Riley, and I'm 7 years old, and I have PH. And I have essential lines. And I have a pump. I can do everything. I can do everything I need to do every day. And I'm happy to be here. And Dr. Hirsch is wonderful.
If you think of anything else to say, you can say it. Okay? Thank you very much for this opportunity. My name is Russell Hirsch, and it's really my pleasure to be here and my honor to be here. And my patient is really good. The very best. So when Katie asked me to talk at this luncheon, she didn't tell me there were going to be 400,000 people. But it really is my pleasure to be here. And then I started thinking about, actually, whose journey is this? Is it Riley's journey and her mom and dad and her grandmother, Kelly and Carolyn, who are here? Or is it really our journey, because it's our privilege to be able to look after patients just like Riley? And I'm not saying that pediatric patients are different to adult patients, but they really are special. And since December of 2014, when I've been looking after Riley, she presented sick, severe PH, heart failure, syncope, couldn't do very much. Her first cardiac catheterization was at that point, when she also received a septostomy. And since then, on and off, she's been on intravenous and intermittently subcutaneous therapy. And as you can see, she's a different child. She truly is able to do everything. Her hemodynamics have virtually normalized, still on triple therapy, but really quite remarkable. But as part of this journey, I just wanted to talk about what I often think of and what I often refer to is the human cost. And the human cost that is absorbed by all of you as patients and all of you as advocates. Her first cardiac catheterization was in December of 2014. Her most recent, I think, was about 2 or 3 months ago. In the meantime, she's had a total of 8 cardiac catheterizations, not to mention that she lives in Lexington, which is 97 miles away from Cincinnati. And that's where they come for their primary pulmonary hypertension care. They travel that way every single appointment, back and forward. They communicate with telephones and sometimes with Skype. There have been Broviac central line infections, there have been intermittent illnesses, there have been multiple other admissions. And all through this, the most incredible positive aspect that you can ever hope for. It is truly a joy going into the room to see Riley, because she is the most wonderful patient, apart from all my other patients that are here who are also equally wonderful. The second part of it, which is part of the journey, is how much we've all learned together from Riley. How despite the handicaps of central lines, the infections, the admissions, the site dressing changes in the middle of the night, yeah, we heard about those. I think all of Kentucky heard about those. But we got through it, and together with your mom and your grandmom and your dad, you got through it, and we all learned together. So it really is, it's been my journey, and Melissa and Michelle and Susan, those that help me every single day, it's been our journey, and it's been our pleasure to be on this journey together with you. So thank you very much.
I would just like to get everybody's attention really quick. There seems to be some residual conversations going on. We would like to ask that you all hold those conversations until the end of the luncheon so that the people in the back can hear the panelists. Thank you. So, thank you, Riley and Dr. Hirsch, for sharing your unique journey. Now it is time to move on to our third panel, Carol Bowling and Dr. Dana McGlothlin.
Okay. I first met Carol about 4 years ago after her initial pulmonary hypertension treating physician left the practice. And fortunately, Carol's pulmonary artery hypertension stabilized on a combination of intravenous and oral therapies. And to this day, I think we both agree, has been her most stable condition. Actually, after having been diagnosed with pulmonary hypertension, she was diagnosed with and has survived 2 different kinds of cancer. But it really was this most recent battle was something that for patients who don't have pulmonary hypertension may not pose a significant risk, not a huge issue, but for patients with pulmonary artery hypertension can literally be life-threatening. This recent battle with cholecystitis, which is infection of the gallbladder, really required us to work together as a team to get her through a surgery to remove her gallbladder. Now, surgery, it's well known that surgery, especially when it involves general anesthesia, poses significant risk for patients with pulmonary hypertension and can literally be life-threatening. So naturally, the surgeons were they were very hesitant to do surgery for Carol, and instead they put in a drain into the gallbladder to decompress the gallbladder and gave her antibiotics to resolve the infection. Carol definitely, having gotten used to one tunnel catheter, was not fond of having another tube sticking out. And the thought of having to go on, like the surgeons had suggested, to live the rest of her life with a tube, this posed a significant challenge. And actually, several tube changes later and complications later, we had to have some tough conversations. Carol really was suffering from having the tubes and the repeated infections, and we got together, we had tough conversations, and she was really emphatic. She was like, I can't believe that after surviving 2 cancers and pulmonary artery hypertension that this effing gallbladder could take me out. That was really tough. But we agreed, and we eventually teamed up, and the surgeon, we had a surgeon who agreed to do the procedure, the best surgeon for this procedure for her. And with good multidisciplinary planning, Carol just went through this surgery, if you can believe it, less than 2 months ago. So, chaos. And so remarkable, she's here today. She actually flew through the surgery from the pulmonary hypertension standpoint, but had several complications that kept her in the hospital for many more days, which she can share with you if she desires. But, you know, throughout this whole process, Carol, when she was dealing with these complications, she still was receiving emails from the new patient, PAH patient support group that she helps to run. And she was responding to these emails, and I'll tell you, it's just, she's one remarkable lady. I really do believe that she is Superwoman, as she's been called by a number of other people. She is the model of strength and perseverance as a PH patient. She also walks the walk and talks the talk when it comes to supporting the PH community as a leader. and she's taught me to be a better physician. So I must say that it's been quite a journey, and I'm proud to also call her my friend.
So I'm going to tell you a little bit about my side of the journey through this gallstone, this miserable, miserable gallstone. So when we had first met up, my current issue with pH was very stable, as Dr. McGlothlin was saying. And the issues we really had to deal with during those 4 years that we've gotten to know each other really were much more about my cancer and the fact of the pain and the medications that I have to take and how that would interact with my pH, because I certainly didn't want to lose my stability of pH. And so it's also very interesting because my oncologist generally feels that his all of what he wants to do is much more important than anything else. Because when you have cancer, they think that tops everything. But what we've had to do is educate him that the heart and lungs has a lot to do with controlling how you live. And so it's been an interesting process of trying to bring different doctors to understanding what pH really means. And Dr. McGlothlin has been my partner all the way through that. She either helps me prepare of what I should be talking so I can understand a little bit more of the medical side of things. And then she's also spoken directly to my doctors. But since we're concentrating on my current journey of this miserable gallstone, I want to let you know it was 11 months ago I was in Disneyland and ended up having horrendous pain in my side and couldn't understand what was going on. I ended up in a hospital in Anaheim, and the doctors and nurses were fascinated that I had pulmonary hypertension. They thought my pump was very interesting, wanted to know all about how to mix it. And I was like, guys, I am in major pain. I will be happy to teach you all about pH, but please get me out of pain so then I can help you. They're coming back to haunt me now. What I did also learn was we did determine that I had this very infected gallstone. They put my first tube in, drain tube, and then they wanted me out of that hospital. Because when you have pH, there are many places that really are not equipped to truly deal with pulmonary hypertension. So the whole time I was there 5 days. I was speaking to Dr. McGlothlin the whole way through it, and she was very helpful to me to keep my sanity because I was dealing with people who really didn't understand pulmonary hypertension. So it wasn't long before I got home and ended up back in the hospital in ICU with my very first of many drain infections. So when you spend 5 days in ICU on heavy antibiotics, and the surgeon comes in and meets you for the first time and says, we are not doing surgery. You have pulmonary hypertension, and at that time really wouldn't even entertain the conversation of having surgery. It was absolutely, we're not moving forward, which any of us who are longtime survivors, we know no is not really an answer that we always accept. And so I'm like, there has to be a way. But at that time, there really wasn't the ability to have a real good conversation. And at that point, that's when the surgeon was telling me, you can live on a drain. So then, as the months progressed, I ended up having to have 3 more drain replacements. With each time the infection was getting more and more serious. And until we had the surgery, we had no idea. I was also creating a lot of scar tissue. I had an abscess that was happening. And all these things were really causing a lot of bad things to my overall system, which was then, although my pH was still stable, but it was affecting my breathing, and we talked a lot about that, and fluid retention. So, I mean, things were getting a little off for us, and so we kept working with ourselves. And I mean, when Dr. McGlothlin says we had tough conversations, some of those conversations are you willing to die to have the surgery? That's a tough thing to hear. But I know her well enough, and I think I asked back, do you think, what do you think, how do you think I can get through this? And we both decided that it would, because I didn't want to live with constantly going in and out of the hospital, I felt like this was the right decision. So I went to the hospital May 5th and had surgery. I had 3 anesthesiologists present during my surgery, and they were all different specialists to handle different parts of the problem that we knew, just the surgery itself, because I'm a PH patient, also active cancer, would cause some complications, but got through the surgery fine. The first night, I don't think anybody would ever think I was a nice person, because the pain was out of control for me. And even though we had done a pain block and everything else, that's when my pH actually was affected, because my blood pressure kept dropping every time they tried to maximize the pain medication. And that got very scary, because it's difficult when you have to manage all those symptoms, but if you get the right people involved, then they can do it. The surgery wasn't easy, but the after part was, I think, harder. But after a few days, we got through it. And I spent 17 days in the hospital because I got an infection in the surgical site. And so we had to deal with that. So then that, of course, changes some of the medications you have to take. And again, for PH patients, your breathing gets affected by that. The higher your pain level is, the more difficult it is to breathe a normal breath, and the more difficult it is to get through just the whole process of it all. But I had fantastic medical care where I was. Dr. McGlothlin came and saw me every day, even her days off. And if she couldn't see me because she had another medical crisis going on, she would text me and let me know, I can't make it today. How are you? Are you doing okay? If you really need me to come, I'll come late. But that kind of support is a wonderful thing to have between you and your doctor when you're going to have any kind of major procedure, because they're going to know, when you're kind of lying to them, like, yeah, I'm feeling okay. And they're going to look at you and say, well, you're not quite acting the way you normally act when we meet together. So it was really great to have the constant team that I was working with through Dr. McGlothlin and her nurse practitioner and her pharmacist and all the people that we have worked with from PH. So she always gave me encouraging words. And when I got home, again, I had a little bit of struggle once you finally go home and you're by yourself or with your husband, caretaker, who tomorrow's our 29th wedding anniversary. Love you, honey. If you're ever in ICU for a long period of time, make sure that you, as the patient, have the nurses smile at them, respect them, make them laugh, because they see you as a real person, not just as a diagnosis. And so many of you have seen me around. I always wear my crazy ears because I think they make you smile. I hope they make you smile. And so it's sort of become part of my trademark. And so I want to present Dr. McGlothlin with a pair of sparkle ears.
Oh my gosh.
Really? Because When I was in ICU, we took a picture together and we called it From ICU to Orlando. And she's always the sparkle in my life.
Thank you, Carol and Dr. McLaughlin, for sharing your unique journey. Let's get another round of applause. What a powerful panel. Thank you to the whole panel. Every one of us has our own unique journey. There are so many people along the way that impact our journey, and we each have an opportunity to influence someone else's journey today. Here at this conference, we hope you leave this session with a renewed determination to find your own personal hope in your journey. Enjoy your afternoon sessions. You won't want to miss the awards dinner tonight from 6 to 7, where we will recognize members of the community who have made a significant impact. Thank you all. Enjoy conference.